why we recommend removing the headrest. It's really an ergonomic thing. If you look at the chairman chair with the extended normal headrest on it, every patient is a little bit differently, and how they sit in the chair, the position of their head is never the same really, because sometimes they have to scooch down in the chair to get comfortable. So many times the head is not really at the foot of, or at the head of the chair. It's recessed, and then because the headrest is sticking out, the doctor has to lean forward, and this gets to be very, very stressful on the lower back and even the shoulders. So that extra distance makes a huge distance. You're far better off removing the headrest and making it so the patient's head is always right underneath your head, right into your belly actually. So this is a video we made many years ago showing this. You might find it helpful if we show it again. In order to understand patient positioning, a brief description of chair ergonomics is in order. Many frustrations with microscope use can be traced to incorrect chair design. This is because one of the secrets of efficient microscope use is to move the patient, not the microscope. Therefore, having a chair that floats is critical. The chair, and hence the patient's head, are moved by action of the clinician's knees and legs, as shown here. When choosing a chair, make sure the chair is easily unlocked and floats, as shown here. A chair that is difficult to move will impact microscope use significantly, and the doctor will be forced to move the scope instead, and this will introduce a great deal of inefficiency. Even as simple a thing as rotating the patient so you can face them directly is made easier by a chair that feels like it is floating, as shown here. Whereas a chair that is locked makes even a simple thing like rotating the chair more difficult, as shown here. To operate efficiently under the scope, the patient's head must be essentially in your lap. If the doctor is too far away because of a protruding headrest, then the doctor will have to bend forward from the waist, as seen here, introducing a destructive Class 5 motion on every single patient. Therefore, on most dental chairs, the headrest will need to be removed. The lack of headrest is compensated for by the use of a Tempur-Pedic pillow, which is placed behind the patient's shoulders. This pillow supports the head and neck and is very comfortable for the patient. As shown here, sometimes a second pillow is needed for support.